With more is Fox News medical contributor Dr. Nicole Saphier and the author of Holding the Line, Texas Congressman Dr. Ronny Jackson. Doctors, I want to thank you for joining us tonight. I want to start with Dr. Saphier because, quite frankly, she's my favorite of the three of us sitting here. But I want to talk about masks and the mask mandate, because it's driving me crazy that, 4-year-olds on airplanes are having to get masks. I saw a story earlier this week about kids in New York City sitting on the 32 degrees outside on the cement, separated from their other, classmates, trying to have a meal, but having to also wear masks. What is going on with masks? What's the reality, Dr. Saphier?
Well, Jason, I can tell you, as we see Omicron going around right now, it is extremely contagious, highly transmissible, and the single cloth masks that the children are wearing are likely going to be ineffective, not really doing anything, because as we see such a high transmission, it is likely a lot of these virus particles are aerosolized, and we know the single layer cloth masks really don't do much for that. Many people are having mild symptoms or even asymptomatic, so it's not going to be those heavy respiratory droplets that are transmitting the virus, as maybe we saw more of in some of the other variants. I put out a tweet earlier this week saying at this point, these masks on children are really for optics, and it's time to remove these masks as they are not really decreasing transmission, and all they are doing are having some negative impacts on the children. Now, the best thing you can do for your child, of course, if they are high risk, if they have chronic medical conditions, is get them vaccinated after a discussion with your pediatrician. But I can tell you, Jason, just based on the CDC data alone, over 2/3 of children have already been exposed to and recovered from COVID-19. This is our lowest risk population, and about 10 to 15%, maybe more at this point, are vaccinated. So this extremely low risk population already has a lot of surrounding immunity within themselves. It's time to remove the masks and focus on providing high quality masks to high risk individuals.
Yeah, you would think that targeting those at highest risk and making sure they have the proper masking would be the priority. Now, I'm toggling between COVID-19 and Joe Biden's saying that he wants to run again if he's doing as well physically and mentally as he's doing now. But Dr. Jackson, you've seen presidents up close and personal here. What did you think of that when you saw and heard Joe Biden say that he was in just such great health?
Well, Jason, I think that's a low bar, man. I can tell you right now, if he needs me to answer that question, I can tell you right now, he is not physically or especially cognitively fit to be our president currently. There's no way he's going to be that way when for a second term. So it was kind of comical when I heard him say that. I just thought to myself, the whole world's watching. The whole world knows that he's having cognitive issues right now. That was just kind of a crazy thing to say. But I think he may be giving himself an out, knowing what's on the horizon.
Dr. Saphier, I want to go back to the COVID-19 here for a second, because testing seems to be an issue that caught Joe Biden by surprise. I would have thought that we would have just millions of tests ready to go. And I think it was December 2nd that the president said that everybody could go to their pharmacy and essentially get a free test. But I showed up at my local drugstore and, oh no, they wanted, $30 for this or whatever it was. And I'm lucky that they had one. These tests are not readily available. And I can't believe we're this far into it and you can't go get tests as easy as can be.
Well, Jason, I can tell you I had the privilege of interviewing President Trump in April 2020. And the first thing I asked him was, I said, where are the tests, President? The lack of testing, the inability to test is the Achilles heel of our response in the beginning of the pandemic. Well, anyone who is quick to criticize the Trump administration and the lack of testing, like myself, should also be criticizing the Biden administration, because here we are nearly 2 years later, and we still have a complete lack of ability to efficiently test. And I can tell you they're creating and making this problem even worse, because you have Dr. Fauci and Dr. Walensky saying everyone needs to go and get a test. You need to get a test before you see your family. You need to get a test anytime you're exposed to COVID. You need to get a test to return to work. You need to get a test to go to a Broadway show, and so on and so on and so on. And maybe we should cut back on how many people we're telling to test so we can stop having such a supply shortage, and the people who actually need to be tested so they can be treated can actually go and get a test.
Yeah, a fit 17-year-old who's otherwise totally healthy. I don't know why we're trying to do this to them. Dr. Jackson, whatever happened to the whole idea of herd immunity? Whatever happened to natural immunity? What happened to all the people who actually did have COVID and got through it just fine? Why is it that the government still does not recognize that those people are in great shape? And thank goodness they got through it and got through it well.
Well, Jason, I'll tell you, because the Biden administration has never focused on testing, therapeutics, or things like natural immunity, which are important to a lot of people out there. The reason is because they need to keep the COVID fear factor at a certain level. And the best way to do that is to focus on mandatory vaccines and masking. That gives them an out so that they can blame the virus on anything and everything that's not going well for them, on their failed policies, on rising crime, on the smash and grabs, on inflation, on rising gas prices, on the falling poll numbers. It gives them an out for everything, and it also gives them the ability to control our lives, which is a large part of this. And I think you just marked my word, and I think you'll agree with me on this. In the future, it's going to give them another reason to call for unsolicited mail-in ballots. In the upcoming election. So I think that those are things they don't care about. Those are things that don't fit their political agenda. And I don't think you're going to hear them talk about that at all. For the first time, they're talking about therapeutics now a little bit and talking about testing. But they're not going to acknowledge natural immunity. I don't see that happening. That goes against what their end goal here.
Yeah. No, Dr. Jackson, I think you're exactly right. And I got to tell you, Dr. Sapphire is still my favorite. No offense. I thought you were great, but Dr. Sapphire is still my favorite.
Jason.
All right. Well, thank you both for coming out. Have a wonderful Merry Christmas.